So, ladies and gentlemen, after these two very insightful speeches that set the context, the broader context of our conference, we are going to progress with setting the scene of the discussions of these 2 days. Let me introduce my panel to you. I just have to be sure. I would like to introduce you Professor János Réthelyi, who is the director of the Department of Psychiatry and Psychotherapy of the Semmelweis University Faculty of Medicine. Astri Arnesen from Norway, the president of the European Federation of Neurological Associations, EFNA. Tünde Koltai, the president of the Hungarian Alliance of Patient Organizations, and Dr. Parellada, a psychiatrist from the Hospital Gregorio Marañón de AMITEA. I'm very happy that you accept their invitation, and I look forward to our discussion today. I am Borbála Schenk, the head of Department for International Affairs at the National Research Development and Innovation Office, which is the main organizing body of this conference. When we were started thinking about the program of this conference, we had one major driver in our minds, which was multi-stakeholder approach. And this is very nicely reflected in our panel as well, because in this panel there are researchers, representatives of professional organizations, representatives of funding bodies like me. And I would like to induce a discussion in this panel which reflects this versatility of the stakeholders of the brain health research. If we think about the objectives of the Hungarian presidency of the European Council, we see that overcoming the fragmentation in research, development, and innovation was one of the most important aims of the presidency. And overcoming the fragmentation of research, development, and innovation can be tackled in two levels. One level is if we think about the geographical fragmentation, the innovation gap between advanced innovators and moderate innovators, and also the fragmentation in the quadruple helix innovation ecosystem, which is basically about how to bring together academia, industry, decision makers, and the people, the citizens. We do believe that if you take a look at the conference program, we are going to have interesting discussions in all or in both of these two domains. And as Director Norstedt said, we might going to have some sensitive discussions as well. We might have to face challenges and difficulties, but also this is a great opportunity. We believe it's a great opportunity for all of you to take stock of where we are and to talk about the challenges and try to come up with new directions, with new solutions to what we are already facing. In this panel discussion, I was preparing 2 sets of questions, and I would like to ask now our panel members to reflect briefly on the added value of the European collaboration in brain health research. So we all know that Europe is very strong at research, though we saw the figures of the Draghi report, but still we are very strong together, and health research, brain health research, is an especially important domain of this European RDI collaboration. How do you see, what is the added value of this research collaborations? Professor Réthelyi, if you would start.
Thank you very much. Are you sure I should start?
Yeah, now we are going this way.
Okay.
And the next question will be that way.
I thought ladies first, but I'm glad to answer. Thank you very much for the invitation. I'm János Réthelyi, and I work at this university. I'm the head of the Department of Psychiatry and Psychotherapy. I'm an adult psychiatrist. So to some extent, I represent Semmelweis University. I'm glad there's so many guests and foreign guests at our university. And I also represent the Hungarian Psychiatric Association and the professional college of the Minister of Healthcare in the area of psychiatry. So I have different tasks, and then I represent different bodies at this discussion. But I will try to come to your question, what the added value of the European context is. The simple answer to this question is that we've all participated in European EU-funded projects, Horizon 2020 projects, and the like. I personally, I always enjoyed working with European colleagues. I think this type of research has its challenges. Researchers often prefer working with their small group, and it's you have to. There's some challenges if you want to bring researchers together and share their ideas. But I always think the added value is much more, especially if you're thinking about clinical studies, not only basic research. For example, you can do a multi-locus study, a different multi-center study in different European centers. I personally always enjoyed that, and I see a great perspective in that. And also the integrative and holistic nature of EU projects that I've been to is that we always try to, for example, about schizophrenia or ADHD or any psychiatric or neurological disorder, that we start from the basic level, from animal models, from cellular models, and then we also have clinical studies, so-called investigator-initiated study with patients. And I see this is the biggest strength of this of the European perspective, that you can bring together researchers and clinicians from different countries and also representing different levels of research. And if you do it in a clever way, something interesting can come out of that.
Thank you very much. Dr. Parellada, what is your take on this question?
Yeah, thank you very much. I shouldn't be here because the invited person was Mara Dirsen. It was also called Mara, that's easy. But she's the president of the Spanish Brain Health Council. She couldn't make it, so I came here as a member of the council, but also as a child psychiatrist, clinician, researcher, the vice president of the Spanish Association of Child and Adolescent Psychiatry, and the president of the committee that assesses the Ministry of Health in child and adolescent issues. So it's a great opportunity to be here. So just a few tips so we can elaborate on that. So I think one of the greatest opportunity is that we are in a very special part of the world. So if you compare our situation with other parts of the planet where they have a lot of research, we are probably the strongest in the largest scientific tradition. We have the largest ethical tradition compared to other parts of the planet. And but we are atomized in different regions with different speeds and different expertise. And each of these regions in isolation is too small to do the research that we need to do nowadays. There are many questions in brain research now for which you need large numbers of participants, of experts, and of expertise. And one of us alone as a country cannot reach those targets. So we do bad science if we do it by ourselves. There are many challenges to integrate all together because we have very, very different expertise. But I think this is a great opportunity because of that. So we have to take advantage of the different expertise. We know that translational and multidisciplinary research is what we need now. So we need the expertise not only on brain sciences, but also in immunology sciences, endocrinology sciences, how they affect the brain, but also in environmental sciences. So there is a lot in our social ecosystem as the risks with digital, social media, and all that is affecting the health and the development of the young people. So we need many, many different experts from different disciplines, and it's impossible that we individually really can combine all those expertise.
Thank you very much. President Koltai.
Thank you for the invitation, and I try to represent not only the Hungarian but also the European patients. And I think that the first added value from my side, that we started to speak about the mental and brain health as a very important topic of the healthcare all over on the world and also in Europe. And I think that this could be a very small step to have a unified, high-level, quality-based healthcare system in Europe. Now, at the moment, healthcare is a national responsibility. But we see that how differences are, not only in the countries, within one country, but also the different member states. So I think that that's very, very important, that the stakeholders see how others are doing the same, they are facing the same problem, and they have better or stronger solutions for the same, and giving answer to the same problem. So I think that if we can exchange our experiences and build into our national system what in the other developed countries are doing. So I think that this, for me, that's a very, very important message.
Thank you very much. President Arnesen.
Yes, what is there to gain from European collaboration in the brain health space?
Absolutely.
That's the question. So what is there not to gain? I think that's my counter question. I think this Rubik's Cube is a nice kind of visual way. If you look at it, the most you can see are 3 of the sides. So nobody sees them all, and it depends on what you see, depends on where you are. And I think that's also the case for Europe. We are, so heterogeneous and still homogeneous in many ways. We have a very strong, all of us, I think, national healthcare systems and good universities for sure. And we still have inequalities in terms of where the best experts are. And to have this infrastructure put in place where we really can connect the best people. And also, this is particularly important when you deal with innovation. We need the best brains to work together to create the nice patterns that we want to create by this Rubik's Cube. I mean, the brain is the most complex organ we have in our bodies, so it's a complex landscape we are working in here. And that's why also the coordination and really having the horizon always, on your mind is so important and can really benefit us all. I mean, we have to do better. For most neurological and mental health diseases, there is very few therapies available. We have to do better, and we can do better. We have accomplished so much, for instance, in the cancer field, through thorough European collaboration over decades. Let's just do it.
Thank you very much, and also thank you for linking the aim of the conference so nicely to these little cubes we prepared with. as a representative of a funding agency, I could relate to basically everything that my distinguished panelists have said. We sometimes, or I sometimes, consider our work as a kind of a treasure hunt, because we are looking for this talent, this creativity, this spark of innovation that will make a progress in, of course, on a national level, but most importantly from our conference perspective on the European level. How can we find those talents? How can we make sure that these ideas are not overlooked? So it is a very important question for us as a funding agency. And this would be my second question to the panelists, is that, so how can we make sure, it is a very difficult question, I know, but how can we make sure or make it easier for these actors to connect with each other, to make sure that wherever in Europe there is a great idea and a great mind will have the chance to be able to to bring his or her idea to the level when it can actually produce European impact for the European society. So how can we make sure that these actors participate, and what are the real challenges of this participation? Let's start from here.
Okay. I mean, how you shape the calls are really important, and to stimulate creativity and innovation is a separate kind of exercise. It's not just about the solid science; it's also about the creativity part. And I think you need to shape the calls, and you need to be able to do some risk taking, as the payers also to allow for that to happen. Because if you always stay on the safe side, very little happen in terms of innovation. So I think that's really important. And I think we have a lot of very good, NGOs in Europe, the professional societies, the patient organizations, for instance, the European Reference Network. We have a lot of health data space infrastructures being put in place and developed as we speak. And I think making better use of them. We just need to better use what we already have, and maybe a communication when the calls are shaped with some of these societies or organizations would be very beneficial in terms of opening up that dialogue before setting the course.
If I may reflect to that, and I know that there are many colleagues who are representing funding agencies or funding schemes from all over Europe. How do you see this risk? It is a very interesting thought. So what is the risk you are missing from this system? Or what is the, I'm not saying that you are missing, but what is the risk these funding agencies should aim towards?
I don't think I'm the right person to point out that, honestly, because I've never worked in the funding agency or anything. I just see it from the other side, from the output side, where I am thinking, I've been part of some EU projects as a patient representative, and I see that the way that it's too kind of, I don't know, in the box, think a little bit outside the box and allow for that to happen would benefit the outcome. I don't have the answer to your question, sorry.
Thank you so much for raising this. President Koltai.
And I also can't answer your question, but I think that the biggest challenge to the European community as a whole, including the countries and people and the citizens, when there is a project and the result of the project is not useful for the people who was the target group of the project. That's absolutely waste of money and time and energy and human resources and so on. So that's something that who is making the call for the initiative or the European European project. I think that they must be more clever than was in the past, and must involve the patients, the patient experts from the beginning of the course to determine the real values of that project. So I think that without that, the money will be spent without any useful result for the patient on the street and in the families. So I think that this is, from my side, is that the message.
And how do you see the willing of the patient organizations to participate in these projects? Is it very difficult to mobilize, to awake the interest of these organizations in participating in these projects? Are there fears among the organizations of participating? So how do you see this from your perspective?
I think that the biggest problem of the patient organizations all over in Europe is the financing of their, not the project, their daily life. It means the operational costs couldn't be covered by projects. So if in our country and in other countries, the biggest problem that facing the patient organizations, that their future is uncertain. They can't calculate, okay, I have a certain budget for this year, but I don't know. I can't be sure that the next year I will have the minimum budget for my minimum operation, or what are my sources for applying money for that. That's the biggest challenge for the patient organizations. We are here. There are very good patient experts on each disease group, but sometimes we can't take part of valuable project because mostly we are working volunteer. We are underpaid. Our knowledge is not acknowledged, is not paid even by the projects. And then I think that if we can go forward on that way, I think that the patient organization, the patient experts are ready to cooperate on any level, at any project. Not the same person naturally. So that's I think that we can do it, and we are ready to do it, and we are more than happy to do it.
Thank you very much, Dr. Parellada.
Yeah, thank you. I think your question was about how to increase or how to, catalyze the talent and creativity, I think. I think in that sense, family and patient associations is one of the greatest opportunity with some challenges I will say a little bit about. But we have to think that scientists, we are more limited in the sense that we know how to take care of patients and how to do scientific research, and that's it. But in family associations, in patient associations, you have all kinds of professional backgrounds. So if you use that force wisely, then you can really be very creative and bring in perspectives, social perspectives, including, for example, in my field, neurodevelopmental disorders and autism, so philosophy, sociology perspectives, which are very, very important. So I think that we need family and patient associations to do that, to really include the general society perspective, because they have all kinds of backgrounds. That comes with a big challenge, in my view, in addition to what she was saying, of course, about funding and expertise and time and everything and support, is that the patient and family associations are really representative. So I think they have to be professional in their work also, and represent all stages in diseases. For example, in autism, it doesn't anything to do like high-functioning adult patients with intellectually disabled children who have needs that are better accounted by carers, families, and so on. So I think a sophistication of the work of the family association with representative perspectives is one of the best ways forward.
Thank you very much. You touched upon a very important point, which is involving more and more disciplines and fields in brain health research. Do you have any good experience in collaborative research when there were very different types of disciplines and social sciences also involved?
I think that's a pending issue, but for instance, I have seen that there are philosophy congresses on autism and how to define what is a disorder, what is neurodivergency, and I think we need to sit together and really set up common terms and also needs. I have some good experiences with high-functioning autistic patients giving input in our projects, for example, and parents of kids with autism, but also bad experiences. In that closed groups with certain needs, for example, high-functioning people, giving a perspective for low-functioning and having totally different targets for the same disorder. So, but that's only to learn how to do it better and how to really come together the different perspectives within a disorder. And with social growing healthy brains for children and adolescents, you need experts, and we have good experience with that, in social media, for example, how to communicate to children and adolescents to nurture healthier brains, for instance. We don't know how to do that. You need the experts in the social media and digital technologies for that.
Thank you.
Yes, I just wanted to comment, sorry, on the same question. So I think about the holistic or the multidisciplinary approach in research is so needed, because when you ask patients and families, what is it you need? It's the multidisciplinary approach. It's not a neurologist, a psychiatrist, or a one single profession that can really help and solve and be the one person you need. It's always multiple, and it can be a social worker, or it can be a nurse, or it can be whatever profession, occupational therapist, physiotherapist, you name it, depending on where you are in your disease and what you need. And to do more research on the importance of these interventions is crucial for how we build up our healthcare systems and really equip them to do a job that helps. That's what we need. We need help. And we need research to document the value of what comes out of that.
Thank you very much.
So the original question was how not to overlook genius ideas. And I think that's very important. My personal view on that is you need functioning institutions, universities, research institutes, also healthcare units, so hospitals or clinics, and learned societies and patient organizations. And if of course, that's also a financial question. If these institutions are working well and they're not fighting for survival all the time, then the big ideas will come forward. You need working small research groups, clinical units, where really which can function like idea labs. And if somebody has an idea that can nourish, and they can talk about it, and it can come forward. Risk-taking, I'm not sure what the best strategy is. You could think if you have institutions that are working well, that have a track record of solid scientific output, you can always take risk, and you can expect those institutions to or those networks to go on and come forward with the next great idea. And I would like to draw attention to one problem that I think exists, and we have to talk about this in the next 2 days, and that's what I call a knowledge gap or translational gap. Especially nowadays, I'm 90% a clinician and a clinical researcher, but I also do basic research, and I used to do much more basic research. And when I was working in the United States in a basic in the Salk Institute for Biological Research, I realized that there's a huge problem that people doing basic research will not necessarily understand what clinical researchers are doing, and vice versa. So there need to be people who translate between these two groups, which is always difficult. But also we could extrapolate the same problem between, let's say, clinicians, psychiatrists, child psychiatrists, neurologists, and patient organizations. I think we understand each other in a way, but also a lot of translation has to be done. Why is this important? Why are the patients, why are the healthcare users emphasizing this problem? How does this impact the lives of patients and their families? I mean, let me just tell a very simple and oversimplifying experience. Let's say a basic researcher wants to make a new transgenic mouse model of autism. Patients will not see why that's important. Why should that be funded? And I think both groups have their truth, and it has to be, this is like a translation. We have to go back and forth and tell each other why this is important.
And what do you think, whose task is to be this translator?
I'm not sure about that. It's researchers, you know, the nature of research is that you want to go deeper and deeper in a small field, and you don't necessarily want to start looking in a broad sense and translating between areas, because that's a lot of energy. I don't know. Let's talk about that later during the conference.
To add this bit, because translation of the medical literacy to different target groups and different people and different level is my preferred message always in the conferences. Because it's very good when we agree on a very good guideline, very good material, a document on English, on very professional language. Okay, we agree to translate it in lay language, lay English, but we need to translate it into different national languages that we must be sure that the people on the street will get the same message as the high-level scientists and researchers agreed and proposed to all of us. And this also need money and need time and it's always forget from the results even from the European projects when many countries are there. So that I think that to plan a project must be included a part of the cost to make translation into different national languages.
And also to add to this, which I think is a key issue, it's like science, communication and divulgation. I think we need specific calls for that. And and I would say that clinicians are in the best position to do that if you provide them with a little bit of time and funds for do that. But it's not that much. It's only to give it the space and the importance. The clinicians are in the best position. They talk with patients all the time, and they can understand the science. But I think you need to really organize that in specific calls to update the scientific knowledge regularly. When we have done that for patients in the form of newsletters, where we give them every 5 years a summary of what we have done with their time, involvement, and so in research, they are so grateful and they participate much more, and everybody is happier.
Thank you very much. I think we have time to take one question from the audience. I was very happy to see a lot of nodding while we were discussing. So I'm just looking at the audience. Whether there is any question. It's still not working. No.
Now, sorry.
Oh, yeah. Okay.
Thank you very much for this really interesting and insightful discussion. I really liked your last point, that we need translators between patient representatives and basic researchers. I think it really needs to be scientists. Maybe it's mainly clinicians, but maybe not only clinicians, but anybody who really understands the value of science communication and has an interest in translating all this relevant knowledge into lay language, because that's really, I think, at the end of the day, what is important. I really liked your point that the people in the street need to understand why we need this basic research. That should be the goal.
Thank you very much. Who would like to reflect to that?
No, I can just reinforce the need. And I think I really don't understand why it's so difficult to speak easy about what you do, even if it's complex and I don't know, complicated. But so for me, it's not difficult. It's just doing it. And I think the importance of having this dialogue that we have here today between different stakeholders is super important, and it's very helpful for all. That we understand each other, and that the basic scientists see also the value of this coming actually into some benefit for where we are in our lives, and vice versa. I understand that basic science comes first when we develop therapies, but it's a long road, so I need some explanation to really be patient and wait.
Yeah, I wanted to make a last comment that has some connection with that, which is one of the greatest challenges in getting involved in, in European projects or whatever. It's really huge effort consuming for researchers, and you end up spending much more time in logistics and trying to work out the administrative, the regulatory, the legal procedures, and with little time to do the work you are more expert in. So that's a claim for really support, time, money. We need more time to set up projects, much more time and money. And we love doing this science communication, or many of us love it, but we need time, and we are always running against deadlines and timelines, and sometimes losing time that others can do in things we are not expert in. So for that, we really need a lot of support to get involved, and not only to say in your CV that you have been part of a European project.
Maybe we can build an infrastructure within these brain health programs where we have support provided to those who want to apply for funding, instead of having the consultants take the 10% out of the money you get. Or more.
As a funding agency representative, I felt personally touched by the suggestions of reducing the administrative hurdles and allowing the researchers more time to actually not only to do the research, but to be able to make sure that the results will not only in like quotation marks, stay in academic journals, but reach the people whose life they are supposed to make better. So, of course, as funding agencies, we also have our perspectives. I would be happy to share it throughout the coffee break. But we have to wrap up this panel now, and I would like to ask you, as this is the scene-setting panel of the conference, so what was the burning question for you when you came here? That what is the question you would like to find the answer throughout these 1.5 days of discussions?
Difficult, burning question. I'm so happy to see colleagues who I've met earlier, and I'm sure we will discuss some burning questions about research, and there's also an opportunity to meet new colleagues. The burning question is really how you could do these projects, international European research projects, in a better way, more efficiently. And one aspect that we haven't talked about is training. I've been involved in a couple of EU projects where training was also very important, and I believe that's also part of the game. It's very important, not only to every aspect that we talked about it, but to also involve young researchers.
Thank you.
I was new in this kind of activities, so I was amazed and a little bit overwhelmed by the number of different institutions, societies, agencies, federations, associations. So I was hoping to live here with a clear idea of who is who, where is the support, to see that there is a common roadmap of really understanding where are the challenges, so the infrastructures that are needed, but stable and long-term, so in order to support that each of us does his or her job more efficiently. And so unify all the multiple efforts that are being made in different countries and institutions.
Thank you.
So I think, again, I start from the people on the street. So I think that when I can see, or we can see, that the people with brain disorders and other chronic disorders, their quality of life and health-related quality of life will be better than it was yesterday. So I think that this is something that we can have as a target. Short-term, medium-term, long-term target to have the patients and the people on the street much better quality of life and health-related quality of life.
Thank you.
Yes, I think I want to end as you do. I think what makes us really successful in the future will be that we get to know each other, that we have meeting places like this. And I love your game, really. I already have 2 actually signed here on my small little notes. So I will get all of you to sign on mine, please, because it's really interesting and it's really important that we speak to each other and learn to understand each other's perspectives. What do you see, a 3 or a 5 or a 6 or a 1? They are all equally important, and it's so interesting to hear how you see that. So that's just my ending here, I think.
Thank you very much. And I would also like to thank all of you for sharing your valuable thoughts and the great ideas. Thank you very much. And I would also like to thank the audience for your questions and for being receptive to these messages. And I wish you and the audience also great 1.5 days of discussions. Thank you very much. Thank you.